Okay. Hello and welcome, everyone. Could I have your attention just for a moment? So let's wave to the bus people. Bus people, you doing good? Okay. I know we were a little bit late on the buses, but we have a great session this afternoon. So we're going to go ahead and get started. If you'll bear with us a little bit, please, by all means, there's refreshments. We know that it was a great day. I heard great things about the site visits already, so that's a wonderful thing. But we do want to go ahead and get started on this important session this afternoon. So for those of you who I have not met, I'm John Feather. I'm the Executive Director and CEO of Grantmakers in Aging, and we're really happy to have you here for this opening day. We used to have this Wednesday session as more of a pre-conference kind of thing, but what we found as we've had this year, almost everyone comes to the day before anyway. We had 150 of you go to the various site visits, so it's been a very active and full day. So we've had this great morning and the great afternoon programs, and now we're going to have a special plenary because this is an important year. For all of us. We know that we live in a very difficult time sometimes in terms of our political discussion, which is sometimes less discussion and more other things. But the importance is we all support programs that are based on making life for older people better. And so all of us have an interest in making sure that we're standing up for older people, that we're standing up for those who need more support. And that's what we're going to be talking about in this important session. A couple reminders. We have jumped into the electronic age like most. So as you've seen, there is not a detailed program book this year. For the first time, we're using an app. And so if you have not downloaded the app, please do so. There's instructions, and the wonderful staff be happy to show you how that works. It allows you not only to see all the materials and everything, but also you can connect with other people here and other things. So please make sure you've done that. It also has games on it and a variety of other activities. Allows you to upload photos and everything else. We want to particularly thank the Retirement Research Foundation for the support of the conference app. So we are so happy to be in Memphis. We are extremely grateful to the Plow Foundation particularly, who is our local host sponsor and are here. This is not a part of the country we have a lot of members, so it was very important for us to have the incredible support of the Plow Foundation, the staff, and all of the host committee that we'll actually formally introduce to you tomorrow to help us prepare for this meeting and to really reach out in the local communities. We want to thank particularly some of our sponsors. Those who are at the highest level of support this year included Archstone Foundation, Cambia Health Foundation, and of course our local host, the Plow Foundation. We also had presenting sponsors at the next level of the ARP Foundation, the Eisner Foundation, the McGregor Foundation, SCAN Foundation, and the Gary and Mary West Foundation. And our participating sponsors this year were the Johnny Hartford Foundation, Retirement Research Foundation, Robert Wood Johnson Foundation, and the Tufts Health Plan Foundation. And as you know, today's lunch was given to you by the Ralph C. Wilson Jr. Foundation. Tomorrow we'll be highlighting some of our local sponsors as well, and they're going to all be listed on the screens for you as we do this. We could not do this without the tremendous sponsorship we get. So let's give all of our sponsors a hand, please. This very important session is being brought to us by the SCAN Foundation and the Gary and Mary West Foundation. And we are particularly pleased because this is such an important topic at this time. And I want to introduce to you the moderator for our panel discussion, Cassie Perry. She's the president and CEO of the Sacramento-based Perry Communications Group, and she will tell us more about our topic for today, how to leverage the power of philanthropy to amplify aging issues in an election year. Cassie?
Thank you, John, for that kind introduction. And thank you to GIA for the opportunity to present a case study about a campaign that we're working on in California that's very near and dear to my heart. And I'm pretty excited about sharing some of the findings. As John mentioned, my name is Cassie Perry with Perry Communications Group. We're a Sacramento-based public affairs firm. And we've had the distinct pleasure for the last 8 months or so to work with 2 California-based foundations that are very focused in the aging community space, the Gary and Mary West Foundation and the SCAN Foundation. But before we dive right into that, I want to make sure that those that are watching us online and participating online and those in the room, if you're going to share and tweet and post, use the hashtags #StandWithSeniors and GIA Aging 18 so that others can follow along with this important conversation. So today I'm going to be sharing with you a public education and awareness campaign that we used the gubernatorial election in California as a hook, so to speak, to get people focused on an issue that's really not talked about as much. All of you in the aging space are obviously very aware of trying to cut through the clutter and get these issues discussed. And we use the gubernatorial campaign as a reason to educate and share the issues that are of importance with the 2 candidates, and through that, through the voters and the public and legislators as well. And while we'll be discussing California, I want to make sure that everybody thinks about your own region and how you can use some of the learnings that we've had in your region to address and catalyze change. Because it's not just California that's seeing a booming kind of demographic change. It's happening around the country. I don't have to tell you guys, every 8 seconds, someone in the country is turning 65, and senior issues are front and center for everyone. So first, I'll be providing an overview of the campaign as we've engaged in it the last 8 months, and then I'm going to turn it over to our distinguished panelists who will be joining me up on stage, because they can talk about some of their learnings, some of the highlights, and some of the obstacles as we've gone through this process. And those will be Bill Early with West Health, Mari Nicholson with the SCAN Foundation, and Paul Downey with Serving Seniors. And it's our hope that by the end of the session, we'll give you guys some good ideas, some information, and maybe even inspire you to take a look in your own communities at doing a public education campaign that can spark a discussion and perhaps get other organizations to catalyze change with new policies. So as you're aware, because you're all senior experts, I don't have to share with you, that senior issues are not at the forefront of the election dialogue, and it's awfully polarized at this point, and I'm not sure at the national level we really want it there anyway. But we really have to start focusing our elected leaders on this coming demographic and the fact that our systems are not structured nor scaled to really provide the care that older people need. To give you an example, in California, in the next 12 years, our 65 and older population will grow by 90%. That's 4 million people. That's more people than in the entire state of Oregon or Oklahoma, or about 20 other states in the country. So it's a huge number to grapple with. Many of these folks are living in poverty. In California, we have the 2nd highest rate. 1 in 5 live in poverty. These are the folks that taught our kids, that built our cities. They've done nothing wrong. They saved. Maybe they had a loss of a spouse, not enough retirement savings. And now they're grappling with issues, and there aren't enough caregivers and healthcare, and the system's not set up. So we really do have to change the systems that are in place to ensure that we can address their needs. So with that grim discussion, what can we do about it? Working with West Health and the Gary and Mary West Foundation and the SCAN Foundation, we conceived of a campaign to energize the senior advocacy groups, voters, the public, legislators, and other stakeholders to use the election to catalyze that change and discuss some of the changes that need to be made. By joining forces and We Stand with Seniors, West Health and the SCAN Foundation knew they had a better chance of joining forces and working together to engage voters, stakeholders, and policymakers than they would have if they'd stood alone. So they joined forces and leveraged their intellectual, financial, managerial, and social capital to create an impactful campaign and encourage California's elected leaders and candidates to focus on needed policy changes that we can address in the coming year. So, how did we do that? We Stand with Seniors cut through the clutter of the media by shining a light on California's need for a master plan for aging. It's been decades since an administration had really put together a plan. The campaign participated in forums with stakeholders throughout the state. They leveraged opportunities to get the message out and amplify the need for improvement for care for seniors. And they engaged and mobilized supporters throughout the state to focus on a coordinated system of care. And it worked. We started the campaign with a voter survey of all of California, asking a series of questions around senior health care issues. And we used that survey because we know that most elected leaders or candidates, what do they pay attention to? Polling. So we tied We Stand With Seniors campaign and the March launch to a voter survey that showed that 9 out of 10 voters thought that it was important that California have a master plan for aging. We were surprised by that high number. In fact, our pollster that works on this all the time was kind of shocked at that high number. But even more surprising, 57% of the respondents said they'd be willing to not just support a tax, because sometimes that's someone else's money, but they were supportive of taxing themselves to create a senior care program in the state. And so with that startling data point, We Stand With Seniors was able to secure one-on-one meetings with the 5 candidates for governor, this is pre-primary, and asked them each to sign a pledge to stand with seniors, which they did. And the footage of each of the candidates we then used through social media, through digital, and shared to, again, get them to commit to it, so they can't say they didn't, and we can hold their feet to the fire, as well as it gave us the momentum to continue to educate the public about the need for it. So we worked on stakeholder events, we created toolkits to send out to our membership, regular outreach to partners, and proactively conducted media relations and worked on op-eds throughout the state. And again, social media and digital, as well as a paid advertising component. As an example of one of the campaign's tactics, shortly after the June primary, We Stand With Seniors conducted a second voter survey, and we polled with additional questions, and then we shared that in the basement of the Capitol with policymakers, stakeholders, and their staff. We had about 60 legislators and their staff and stakeholders there to share the findings. And I'm going to show a brief video that will kind of get you a feel for the day.
We have an amazing opportunity here in the state of California. California is the 5th biggest economy in the world. We need decisive leadership. We need to hold our policymakers accountable, and we need to create an action plan for aging.
If somebody is worried about where they're going to sleep tonight, none of the other stuff matters.
And the results, I think, were uniformly staggering.
Realistically, from a political perspective, aging has not been a priority.
So there's really kind of a three-pronged issue, which California is not only not prepared to meet the need in the future, but I don't think they're currently meeting the need today.
Talking about access to health care, to access to dental care, access to community resources.
Well, you can support those caregivers at doing their jobs.
We have to put a laser focus on it, and we have to say, this is the problem. Now, let's come up with a solution.
Hopefully that got the blood pumping. And then just last month, we worked hard to get this, I assure you. The two major candidates for governor, John Cox, a businessman, and Lieutenant Governor Gavin Newsom, we approached them to speak at the SCAN Foundation's California Summit. And in working with the two teams and all of the support that was generated, we were successful in getting both candidates to address the summit. I'm going to play their videos for you. You'll notice that one references Bruce because they were played at the beginning, so they referenced Dr. Bruce Chernoff, the president of the foundation, in the introduction, so I didn't want you to think they were calling me Bruce, so it's okay. One of the things is, in this environment, getting a Republican and a Democrat, they're usually so polarized, to agree on something like a master plan, and in such a short time period from the time of March that we started the campaign, I'm personally pretty excited about it, and I think everybody that's involved is excited about it, and it really reflects the fact that this campaign is working, and people do understand it. They almost just need the push to really start talking about it. So I'm going to play each of their videos for you.
Thank you, Bruce, for that kind introduction. I'm sorry I couldn't be with you today. I'm out in Bakersfield today carrying our message on a bus tour all around the state. And that message is help is on the way. And that's to bring affordability and livability to all California. The work you do is so important. The seniors of this state are the backbone of our society. They've contributed to the growth and success of the state of California, and they deserve nothing less than our full attention and our best efforts. And that's what I'm doing in this race for governor. I'm working to try to achieve results for the people of California. The political class in Sacramento has made this state the #1 state for poverty, has driven up the cost of living, has made it very difficult for working Californians to make a go of it in the state. So much so that half of Californians are deciding to leave or thinking about leaving. We can't have that and be a sustainable state. We need to work together to work on a master plan for aging in the 21st century. We've got to make sure that our senior population, as well as all Californians, have the ability to lead an affordable and livable lifestyle. The true California lifestyle that all of us have gotten used to in decades past. That California dream has been threatened by the political class in Sacramento, and I'm determined to do something about it. We've got important issues on housing, transportation, infrastructure, water, electricity, not to mention the fact that our schools are now 45th in the nation and our roads are crowded and full of potholes. The people of California are at a crossroads with this political class in Sacramento. I want to bring needed improvement to this state, and I'm going to work diligently to make sure that our senior population, as well as all members of the California population, are brought to a position where they can live a wonderful, quality, and affordable lifestyle. So I thank you for all the work that you do, and know that I'm dedicated to making this state truly the Golden State once again. Thank you very much.
California makes you really want to move there right now, right? And then Lieutenant Governor Gavin Newsom's comments.
Hey everybody, it's Gavin Newsom, Lieutenant Governor, former mayor of San Francisco, and I want to just express my appreciation to the SCAN Foundation for everything you're doing to raise the bar of expectation and awareness around an aging and graying population in the state of California that needs to be celebrated, needs to be invested in, needs a plan to address the long-term aging needs of this state. We have a population that's growing at a slightly larger percentage than the rest of the nation in terms of our aging population. We're not prepared from an LVN or RN perspective. By some estimates, we're going to be bedlocked in 4 or 5 years. There's no strategic plan for the state of California. As a consequence, there's no workforce development plan to celebrate our caregivers that do extraordinary work. And there's no strategy, intentional strategy, to allow people to live in dignity, to live in place, to have the mobility and to have the options and choices in a culturally competent way throughout our diverse communities up and down the state. So it's high time we do all of that. And I want to just extend to you my commitment, not interest, my commitment to lead that charge by taking advantage of your insight, your ingenuity, your faith and devotion to the cause of our seniors. And then also to look at this as an extraordinary gift and opportunity for our seniors to get plugged in and reconnected to their community and more broadly to some of the vexing challenges we have in the state of California. The experience core of sorts, the incredible opportunities, and remember in the vernacular of Sarge Shriver, foster grandparents, the opportunity for our seniors to be a big part of so many of the things we want to resolve and solve in the state of California. So it's in that expectation. So I can go on and on. I'm just enthusiastic about everything you're doing and what brings you together. And I want you to know you're going to have a champion if I can pull this governor's race off in the next 41 days.
So I think you could see once we got them engaged, they're both rather enthusiastic about their commitment, which again, after November 6th, whoever does win and move into the governor's office, I assure you the campaign is going to take advantage of that commitment and work with the transition teams. Because again, when you run a campaign like that, that's the goal. So at this point, I'm going to invite our distinguished panelists up to join me, and they'll share, again, as I mentioned, some of the highlights of the campaign, some of the challenges, some of the obstacles, and again, I'll ask them some questions in I said a Phil Donahue style, but maybe I'll do it more like Ellen. And then afterwards, we'll take questions from the audience. So I'm going to start with Bill Early with West Health. Your organization saw an opportunity that perhaps others might not have. Can you share a little bit about West Health and why you plunged into this opportunity?
Sure, thank you, Cassie, and thanks to GIA for having us here today. And not only I'm excited to present a little bit more to those here in Memphis, but also those that are participating through our live stream. So hopefully they'll stick with us and pick out some important points. So West Health, for those of you who don't know, we're a family of related nonprofit, nonpartisan organizations founded by Gary and Mary West. Amazing couple who are completely dedicated to our seniors. We're so fortunate to have them and have their dedication. We have 3 major organizations across the spectrum. We have our institute out of La Jolla, so it's the Gary and Mary West Health Institute, and that's a medical research organization. We have the Gary and Mary West Health Policy Center in Washington, D.C., and then, of course, we have the Gary and Mary West Foundation, which I think many of you are very familiar with. And so we approximately a little less than a year ago, we were brainstorming what could we do to really have an impact across the state, and we reached across, went up the I-5 and the 405 up to Long Beach and reached out to our good friends at the SCAM Foundation and said, you know what, our missions are so aligned, we have so much in common, we really have an idea that we want to share with you, and how can we come together, and took in their ideas, and we came up with this concept around a year-long, multi-pronged, multifaceted campaign. And then we looked at each other and said, okay, how are we going to pull this off? And so then we looked for the right organization to help us. And so we found Perry Communications Group and Cassie and her team, and with great experience not only in healthcare, but in running educational campaigns. And really, I really want to underline, this was a campaign in parallel with a campaign. It was a campaign that we were running in parallel with a gubernatorial campaign. And all the work that you've seen thus far, that you've heard about, and you're going to hear from the other panelists, this all started, we kicked off March 12th of this year. So all this has been accomplished in that time. I just want to underscore that.
So Mari, as Bill mentioned, West Health went up the freeway to meet with SCAN. How did you decide the partnership would be worthwhile and that perhaps you could do more with that and what the value was.
Sure, and thank you, Cassie. And I just wanted to say thanks to GIA for having the SCAN Foundation today and for featuring We Stand With Seniors today and really kind of letting us tell you what's going on in California. So kind of hearkening back to what Bill was just talking about, West Health approached us at the end of last year as they were kind of percolating on these issues, thinking about doing a survey of California voters. And they knew some of our expertise and they knew our reach across California, so I think they wanted to hear some of our ideas for particular questions. That activity went seamlessly. It was really fun and really valuable, and I think after a few conversations we thought, it would make a lot of sense for two very mission-driven organizations to come together in an election year. We both knew that a governor's legislative agenda is largely set during a campaign, during the election. What he or she commits to largely shapes who they appoint, how they govern, and what they ultimately accomplish. So we thought we could have more of a reach together and really encourage the next governor of California to think of aging in California first.
Thank you so much. And then Paul, you're with Serving Seniors. So of the group up here, you provide direct services to seniors. How is this campaign, how have you felt it kind of in your environment and the value of it?
Well, I think the primary is empowerment. We focus on very low income seniors. Most of them are living in poverty, faced with trying to meet their basic needs. And what we've done is we've spent a lot of time educating about how to do advocacy. We have something called the Senior Leadership Development Institute where we train. And so as part of this campaign, we ask our folks to hold elected officials accountable. I mean, many of you have met elected officials and you ask them about aging issues and they'll get a little tear in their eye and talk about their wonderful aunt, their grandmother, their this or that. And they don't talk about substance, and we're certainly glad that they have great relationships with their grandmother or aunt, but you're looking for substance. So the thing we drill into our folks is when you have an elected official, Republican, Democrat, whatever it may be, is ask direct questions. Ask, what are you going to do about transportation? What are you going to do about housing? And hold their feet to the fire. And that has been very successful. When we were fortunate to have the Lieutenant Governor visited our Gary and Mary West Senior Wellness Center, which is Serving Seniors' flagship facility, and he got some good questions. Bill was there, Mari was there, and they asked him some very direct questions, and we're hoping John Cox will come before the election as well to ask questions, but it's actually stimulated them to go on and at the local level. We were having some issues with one of the parks near one of our housing complexes. There was a lot of drug dealing and whatnot, and they organized and went and held the city council member accountable to do something. So we're seeing benefits beyond just the gubernatorial race.
Right, and that's actually the hope of this, that we'll educate an entire kind of workforce of seniors to be able to hold individuals accountable in local communities. You mentioned Lieutenant Governor Gavin Newsom's campaign stop at the center, which we were obviously excited about having. Bill, can you talk a little bit more about the involvement with the candidates? How did you get them to engage in the first place and kind of what that's looked like?
So just a quick aside from when the Lieutenant Governor was at Serving Seniors, we had a little sidebar conversation and the Lieutenant Governor said, I want you to know, I really want you to hold me accountable to this. And not wanting to miss an opportunity, I kind of leaned into him and I said, don't worry, we will. So I think he got it, which was great. But the tactics that we used, I mean, first of all, the survey, the first survey that we did was a great way for us to get our foot, you could say a foot in the door or maybe using your foot to kick open the door, but it really was because it got their attention. And I think we all know, because we're experienced in working in this space, that it's not just the candidates themselves, it's certainly them, but it's also just as or maybe more important that those that are advising them are on board with it and give you that entree into those candidates. So we used, that survey was very helpful. And as Cassie mentioned, even our pollster, who has seen data for decades, was blown away by what we saw. And so that was the first thing. The second thing, there were some really compelling statistics that came with that, and as we drop those into the conversation, like for example, the almost doubling of the number of seniors in California by the year 2030, and don't look now, that's just around the corner. So, and that's an amazing statistic, as well as 83% of voters. These are voters, stratified surveys, by the way. We can get into the numbers, 3.1 margin of error. But voters who are saying, I will support a candidate for governor who agrees with the vision for a master plan for aging and support for services for our aging population. Those are important. And then the next level was you keep dropping more and more in, and the next one, and I don't want to gloss over it because I think it's hugely important. And the statistic that you saw already, 50% of those surveyed voters saying that they would be willing to pay more in taxes. Now, I don't know if you're following politics in California at all. There's actually a repeal of a gas tax that's going on right now. Many people don't really like to impose a tax on themselves. Right. They're more willing in a lot of cases to say, yeah, I'm willing to increase taxes if she pays for it or he pays for it, but for themselves. It's quite telling and it's compelling, and it's in and of itself, it shows that the work that is being done in this room and beyond is actually paying off, because you don't get those kinds of numbers for that kind of a question very often. And so those were some of the tactics that we used. And then one other point I just want to make, it's just the follow-up. I mean, you have to do the work. Do the work, and it's the follow-up. It's not just the one and done, it's the meeting, it's done. Hey, that was nice. There, we sent something out on Twitter, it's done. No, it's the consistent follow-up and what we like to say, the surround sound of it.
Right. One of the things that I didn't mention earlier that goes along with what Bill is saying is that one of the tactics that we used was trying to get the candidates to do a debate, a We Stand with Seniors sponsored debate by the foundations. Knowing that the lieutenant governor is leading by quite a margin, and having done enough political campaigns, I understand that if you're out in front, you really don't want to do debate, and I'm sure everybody in your state sees the same thing occur. But we got to the point where of all the debates, we were the last ones standing to host that debate until they decided to do a radio debate on a Monday at 10 o'clock, so that it was clearly buried from the news. But all of those tactics and all of that, working with the stakeholders, we generated letters from so many organizations to each candidate saying, we want you to debate and we want you to focus on these issues. So they really did feel a lot of that pressure.
Can I jump in? I mean, and I think that's evidenced by on election night on the primary, when the lieutenant governor got up to give his acceptance or victory speech. I think it was in the first minute or two of his remarks, he talked about a master plan for aging. Mm-hmm. I mean, we all would have, well, I fell out of my chair because to get elected officials to talk about this, I mean, as someone who's been advocating for over 2 decades in this field, getting elected officials to pay attention, and I think probably the number they're paying attention to is that 9 out of 10 people said they'd support a candidate with a master plan. So we now have the leverage with elected officials to say, if you support aging, that's good for you. And we know what motivates elected officials, and so that has caught their attention. But to have him unprompted from us, we prompted him, but on his own to say that was an amazing moment.
He did. He called for a Marshall Plan for housing and a master plan for aging. And since housing, is not specific to our campaign, it's obviously part of the situation in California. We were thankful for that. And just one more follow-up with Bill, because I think it's telling. I know because I was there when you were briefing the candidates. Did you find it compelling that all of them tended to go over their time and stay with you in front of the chart with the numbers and keep discussing it?
I was shocked, especially in the primary, where you had, in our case, we met with the top 5 candidates, and it was, and people are fighting it out to get in that number 2 slot in California, if you were following what was going on. And the fact that we had 30 minutes scheduled, and part of my background, having spent some time in politics as well, I do a time check. Okay, we're 20 minutes in, just wanted to see how we're doing. And then we're at 30 minutes in, hey, you know, we really appreciate your time. It's kind of that give them that out. Not having it, not a single one of them. And in fact, one of the candidates just 1 week before the election, and I'm pointing out my colleague Diana Campau from West Health, and we were meeting with one of the major candidates, and this person, we spent well over an hour, and it probably was close to an hour and 10 minutes, because they were so engaged. And just real quickly, there was a headpiece and a heart piece. And the headpiece was the statistics and the voter survey, right? I mean, that's the headpiece. You can get your mind around that. Once we got into the heart piece, and no offense to my friend and colleague Paul, but they did talk about their mother, and they did talk about their aunts, and you know what? Here's the thing: you could tell. I mean, we've all been around. You can tell when it's sincere and when it's not. And when you're in that small of a group, and there are just a couple of us, in that small of a group, and they're starting to share from that perspective, you know that they get it, and you know that now you have an opening maybe that you didn't have before in that discussion. So you had the heart piece, and then you had the head piece, and together with the idea of accountability and follow through, that kind of led to the success that we saw so quickly, because we were able to get those meetings and had that kind of a cadence to them.
You're absolutely right. And then turning to Mari, the SCAN Foundation has a long history of working on policy issues at the Capitol. You've been well known where West Health is new to the Capitol environment and is becoming very well known. Can you share a little bit about kind of the partnership and how that's kind of grown through this campaign, and maybe how it helps at the Capitol as we're starting to lay the groundwork for some policy change?
Sure. So you're right. The SCAN Foundation has been working on a master plan for aging and long-term services and supports for a really long time, and we've made some inroads, and then at times we've gotten stuck. So We Stand With Seniors really gave us a platform to have more visibility for a master plan for aging and really more energy around it. I think this really harkens back to that concept of capital, which Cassie alluded to on an earlier slide. And it's the capital that both foundations brought to We Stand With Seniors. So first, that's financial capital. Obviously, we pooled our resources in order to do more than we would have been able to do working separately. That's intellectual capital. So 2 foundations, that's doubling the expertise. And I really think that doubling of information and policy expertise really has enabled Perry Communications to help us do more creative things, do things faster, and just be more innovative. And then there is the managerial piece. As you know, political campaigns move really fast. And so being able to share the load of work with another foundation, tag team on giving feedback on things, be more effective and efficient in our messaging, avoiding redundancy in messaging, and really avoiding any type of contradiction that might have happened had we been working on these issues separately. And then finally, there's the social capital. So over the last 8 months, we have built a tremendous amount of trust between the 2 foundations. And we've really pooled our networks in order to disseminate information about the campaign and about a master plan for aging more effectively. I would also add too that, as Cassie alluded to, there's been a lot of stakeholders on the ground working on a master plan for aging for a while, and there's been a bit of master plan fatigue perhaps over the years as things don't change. And I think being able to stand behind this campaign, We Stand With Seniors, it's really provided some new life to the issues, and it got people excited again. And they were so excited, and people were talking about it so much that the gubernatorial candidates really couldn't ignore it.
Right. No, and that's honestly, from having run many campaigns like this, that's what's been exciting, because the collaborative that you've been managing and running for so long is powerful, but I think they all agree they were talking to themselves, what I think happens in these kinds of communities where you're all talking to yourself. So bringing kind of outsiders in and changing the messaging, I think is key to part of that. So next question I'm going to give to Paul and Mari, because I think it's key that when you work in a nonprofit space and a foundation space, I know there are concerns sometimes about political campaigns and engaging, in that kind of work. And I think it's important to address kind of, how do you approach that? Mari, why don't you go first? And how do you engage, in a political campaign appropriately?
Sure. So as an independent public charity, I will just say that the SCAN Foundation doesn't do any lobbying. We don't get involved in political campaigns, but we do deeply get ourselves involved in educational outreach. So this has been 100% a nonpartisan educational effort. And I will say that, from the very beginning, we drew a line in the sand as we thought about what We Stand With Seniors activities would look like and how we would communicate equitably to all of the candidates. And I think that's really good advice for foundations thinking about engaging in the same effort, is to really sit down and brainstorm and think about what this means and think about how to be strategic and effective and really get your message out there and be really rooted in education. I would also add that we did the voter surveys, and so this has always been rooted in our research into what voters want, what they worry about, what they want the next governor to commit to, and that is the information that we took to the public and that we shared with gubernatorial candidates in order to get their attention. And really, we'll communicate with any policymaker who's willing to engage in aging issues and champion our issues. So we just made sure to be extremely equitable in our communications.
Well, as someone who's been in the nonprofit world for a long time, so Serving Seniors is a 501c3, I remind all of my colleagues that we do not give up our First Amendment right because we're a nonprofit. And that allows us to still speak out on issues. And so we focus on education, but we do it in a fiercely aggressive way, shall we say, around advocacy. And I think Mari's right. I think as we do advocacy, we need to be fair, we need to be nonpartisan, we need to invite candidates from both sides or all sides to educate about the issues, but that doesn't mean that we have to stop. If there's a bill that's going to negatively impact our clients, we need to speak out and educate them, tell them why it's going to negatively impact or why it's going to help them. Certainly you have to stay away from things, the obvious things. You can't do a fundraiser for a candidate. You can't endorse a candidate, at least organizationally. Again, as an individual, you certainly can. But I think if you follow basic rules of fairness, being out there and doing advocacy and speaking out is an American right and virtue that we should be doing, and particularly in this environment where there's a lot of disinformation. It's important that we speak out and tell the truth.
Can I just jump in for a second?
Absolutely.
I think it's really important also that when you're engaging, particularly during a campaign, that that the candidates and their teams know that you're playing it absolutely straight. You're operating off a very fair playing field. And so we don't bury that lead. So when we met with each of the candidates, we said up front, listen, we're making ourselves available and we're meeting with your competition. And we're gonna make a lot of the same points, and we're gonna make ourselves available to them as we are for you. Because we just want the result, right? And ultimately, kind of the call of that question is, and obviously so do you, or you should, right? So I think it's important as we go through, because we have to play with folks on all sides and from all political angles, right? So it's not just Republican and Democrat. Decline to state or no party preference is just as large in some regions of our country as one of the other traditional parties.
Right, and that's, and being, honest and with integrity when you approach that. We had, 5 or 6 candidates. 2 of them, we were all pretty sure weren't going to get the numbers to move forward, but we still met with them because that was the right thing to do and shared with them. We also prepared materials that were more Republican friendly and more Democrat friendly as far as policies, one list so that when we sent to the campaigns as far as here are policies to look at, they could pick and choose what they might be comfortable supporting. So kind of playing it fair that way, I think is really what helped us move that forward as much, as we did. Any kind of, we've gone through this fairly quickly. Any other thoughts and things that we haven't addressed? I know that we can talk a little bit about what's coming in the future. We have some, the SCAN Foundation has some legislative hearings. This campaign has engaged the chairs of the aging committees to such a level that they volunteered to do hearings early in session, which again, with a new governor making the transition into the administration is super helpful to be able to point to in January, there's a hearing on this issue to get people engaged. Do you want to chat more about that?
Sure. I mean, we know that the first 100 days after November 6th are just going to be critically important. And so Perry Communications is really helping us organize how we will get some of those meetings, the transition team meetings. And we're thinking long term. There's a lot of momentum right now, and we don't want to lose that momentum. So we're thinking of ways to communicate with the voters post November 6th, have more briefings, have more activities on our website, and really keep up the momentum and get pretty quickly to holding that next governor accountable to what he committed to. He or she, well, now it's he.
Well, I think we have an opportunity to go on offense here. For a lot of the time over the last 2 terms of the current governor, we've been on defense, which might surprise people knowing who our governor is, but he has a very liberal use of his veto pen on a lot of bills that would benefit older adults in the state of California. And so now we have 2 candidates, both of whom are saying, we're going to do something around a master plan for aging. And I think there's an opportunity for us, instead of trying to be defensive and trying to stop vetoes from occurring, actually be able to go forward and get some things implemented, because California has some significant problems, but I think it mirrors the rest of the country. I mean, affordable housing, homelessness among seniors is at epidemic levels in the state of California. I mean, in San Diego, 30% of seniors or people are homeless on the streets of San Diego are older adults, 42% in Los Angeles. San Francisco is similar. And so the next governor needs to do something about affordable housing. You don't deal with housing, you don't deal with homelessness. It's hard to deal with healthcare, nutrition, socialization, elder abuse, all of the other things that are on the agenda. So I think we have an opportunity to try to address some of those, because we've caught their attention and we can remind them, we've got them on video saying they're going to do something about it when they're elected. It's always, that's the key thing, is get them to commit while they're running, so you can hold their feet to the fire after they're elected.
From my perspective, it's an exciting time to be in this space, because of all the work that has gone on from all of you, your organizations, and others that have come before us to get us to this point. But now we're really at a critical point, and certainly in California, which in a lot of different ways across the country, California has shown some leadership in certain areas. I'm not sure that California has shown great leadership, frankly, in this space as a state, but has the chance perhaps to catch up and do some things well. To catch up. And so part of what I want to go back to the meetings with the candidates, because in terms of, for you, if this is something that you're starting to think, you know what, we haven't done it in our state or we haven't done it in our region, and this might make sense. And I will tell you, even through our social media channels, we have been asked by people in different states, hey, when is We Stand With Seniors coming to our state? So Paul and I both sit as commissioners on the California Commission on Aging, and one of our other commissioners says, you have a tiger by the tail here. You should understand what you really have. And it's been such a whirlwind campaign that sometimes you have to step out of it to realize, well, what do we really have? And you know what? We have the collective we, including all of the other stakeholders and all the other people who have raised their hand and signed their pledge and said they're going to stand with us and stand with seniors, we've been able to make some progress. But there are three Ps, so can't come to a conference and not have the 3 Ps or the whatever you're going to leave. But certainly from our perspective, it took persistence. It took persistence in getting after it, and just time and time again. It also took persuasiveness. And by that, maybe a subset of that is do your homework. Understand who you're meeting with. What's their background? What's a connect point that you or someone in your organization might have to make that entree a little bit better. And really the spade work that is done with those electeds and their staff members ahead of time, it makes a difference because you come in with a lot of credibility. And for those that we did not know, having Cassie and her team and other people, that's really beneficial. And the work that, you know, Mari's team and Sarah Steenhausen up in Sacramento from the SCAN Foundation, who is fantastic. I mean, that kind of work matters. So remember, that was the second P. And the third, this is hard for me to say, but the third is patience. Because I have to tell you, in our organization, we wanted things to happen yesterday. I mean, that's just how we look at it. And I'm looking at some of my colleagues, and they're shaking their heads. I mean, but the reality is you have to be patient, because a microcosm of that is when we're meeting with some of the candidates, we had, I'll say a couple, really one, who stuck to the talking points throughout the first 20 minutes, just talking point, and could not get through. And finally, that veneer just got stripped down and we were able to finally get through. It is that importance of patience. You don't know when you're seeding, you don't know when it's gonna sprout, right? But sometimes that aha moment goes off a little bit at a different time frame. That light goes off at a little different time frame for one person versus another. And you can't be frustrated, and you can't be down on them. And by the way, really another side important point is some of these candidates that we knew were not going to be in the final two, and we pretty much knew that, and I think they knew that too. But they're wonderful people, they're smart people, they're connected people, and they have been, they are, and will continue to be impactful for what we're all trying to achieve. And so you show them that great respect, and you have those meetings, and you give them that same treatment as you do everyone else.
I would also, kind of piggybacking on the comment of do your homework, we wanted to be prepared for these candidates to say, well, what is a master plan for aging? What states really do that? So we've done our homework. We were able to say that Minnesota has a master plan for aging, Colorado has a master plan for aging, and that these master plans have things, they have decisive leadership. They have a leader who's committed to it. They're data-driven, they're comprehensive, they're measurable. So we were able to counter any kind of pushback with really great examples.
That was a lovely way to say that, because actually the candidates and their teams just wanted us to send them some policy that they could announce and implement. And we said if it was that easy, it would already have been done. And the master plan and bringing people together, you know, is what really needed to start with that. So it was very, as a campaign manager for this, it was extremely helpful to have that background to use going forward. Anything else you'd like to add on that front?
Don't think so.
So I think we're going to open it up. We have about 30 minutes left. Open it up for questions from the audience, from the experts, and see if we can stump our experts. Yes?
Could you give an example of how the policies might be slanted, Democratic or Republican? I thought that was really interesting.
Certainly. So the question was, could we share how the policies might be more favorable to a Republican administration or a Democrat administration? And I'll share a little about my background. I worked for 2 Republican governors, and then I worked for one of the leading Democrats in the state, the Senate president, when he implemented California's mental health law changes. So I think perhaps I have a good background in writing for the 2 sides. But what we did was really looked at different opportunities. You know, obviously on a more Republican angle, it would be integrated services. It wouldn't be increased taxes to pay for long-term care. It would be taking apart regulations that are obstacles to providing appropriate services. So you're looking at more efficiencies and streamlining when you're looking at more of a Republican staff, and on a Democrat staff, you're looking at more of how do you augment the services, how do you redirect perhaps additional new taxes to provide services. We definitely had more of a labor emphasis because in California, the caregiving community is very focused on the caregiver issue and funding that program. So clearly that was in that you would not typically have a Republican candidate endorsed. Does that answer your question? Is there anything else that you guys would like to add to that? No. Next question.
Yeah, I'm interested in how are you working, or are you working with World Health Organization and AARP with the locals? We're heavily focused on that in San Diego. So how does this integrate?
Talk about the stakeholders and the group.
Sure. So one thing that the SCAN Foundation has kind of a rich background in is we have a set of regional coalitions that we communicate with regularly. Another colleague of mine actually leads that work and is in this room. But we were able to have a few meetings. We Stand With Seniors would meet with them on some of their regular monthly calls to really let them know what was going on and how they could be involved. We have a lot of We Stand With Seniors materials, which we circulated to the coalitions to then circulate to all of their constituents and all of the people that they know. So we were really able to get the word out that way. ARP is another partner of ours on other projects, and so we tried to keep all of our partners abreast of this campaign so that they could communicate about it and, amplify our messages.
Those organizations actually invited speakers from We Stand With Seniors to come in and present what we were doing and what we were doing next, and offered to hold events in the region. And because of the way this campaign is constructed, they don't have to be, our events and We Stand With Senior events. We can send a speaker. For example, if you want to talk a little bit about last week in San Francisco, we had an event hosted by the LGBTQ community open house, which was extremely well attended and generated probably some of the best media coverage that we've had to date.
Right, so the coalition is as broad and is becoming deeper all the time, and so last week we were invited, and I had the great privilege of going to San Francisco to meet with a convening at the LGBT Center in San Francisco, and it was sponsored by a group called Open House, and it was nothing short of amazing, because what we in the press of a campaign, you have all these great intentions, but it's just hard to do everything all at once. You want to, but you're a little bit limited by your resources, and that's not just financial resources. It's time, it's people, it's coordination, it's all those things. But it was so wonderful to be able to go up there and to hear, to share a lot of what you've heard today, but also really more importantly to hear from that community. What's important to that community? And I thought that. By the way, a lot of this information, I'm going to give a plug, a lot of this information you can find if you go to westandwithseniors.org. For those of you online, westandwithseniors.org, and you can find a lot of this information, including an amazing, I think we have it already up on social channels, an amazing piece that was written in recap of our meeting up there. And one of the major takeaways for me, and a lot of you have heard this before as well, is a gentleman in his mid-60s asked the question, I think that some of us think about, and that is, I'm alone. What happens to me? I'm alone. And social isolation and caregivers or lack of caregivers, I mean, that just, it's one of those, time stands still and everybody takes a breath. And I thought it was lovely how the CEO of Open House just really figuratively and literally wrapped her arms around this gentleman, just saying, you know what, we're here for you. But that is a story that will be told time and time again, and it's one of the many issues that we're confronting. So for us to hear from different communities, to have interaction and dialogue with different communities is critically important to our effort.
And one of the things that Bill brings up, and I'd like you to address as well, is that our messaging, while consistent from a campaign standpoint and from a public relations standpoint, our messaging has evolved as we meet with locals in the community. So we are now, when we talk to younger millennials, we're talking about the concerns about generational poverty, which was not one of the phrases that initially, when we created this campaign in March, we really talked about, but it's something that we keep hearing from individuals saying, yes, but if I take care of my father and deplete my savings, and then what happens to me and then my children? So our messaging on that has evolved, and then it captures different parts of the audience's imagination.
Well, I mean, and we're seeing some of that now. Even there are some campaigns, I'm not even going to mention who's doing it right now, that is very ageist, that is pitting millennials versus older adults. And we're seeing that happen that it's a PSA that basically says we've got ours and heck with the rest with you. And we've got to get past that because, and I lecture quite a bit in San Diego State and UC San Diego to those students. And when you start telling them why they should care about aging, I mean, they're 20 years old, 21 years old, and you start sharing some of the statistics that everybody in this room knows, and they start to understand that it's going to impact them. I say, imagine yourself 10, 15 years from now when we start to hit some of the milestones with demographics and say, you're the one who's going to be responsible. You're going to be paying for this. You're going to be caregiving. You're going to be all of this. And so I think the more that we can educate and bring the generations together and understand that this is a common issue, and this is an issue that we know is going to occur. There's a lot of things in the political world and just in the world that you can't predict. This one we can predict and we can have a plan, or we can wake up 10, 15 years from now on New Year's Eve and look at the New Year's Day and say, my gosh, what happened? Where did all of these old folks come from, and what are we going to do? And so I think we still have time to deal with it, but we've got to put the pressure now, or else we're going to be so far behind that the millennials right now are going to get a big bill to try to pay for all of these folks that are going to be depending on Social Security, Medicare, Medi-Cal, all of those, Medicaid,
Absolutely.
all of those things.
Absolutely. Do we have another question?
Oh, yeah. Thank you. I have a question. So getting a plan is great, but it seems like actually implementing and carrying out the plan is, a huge kind of challenge. But do you have any sense of how well things are going in the 3 states that you mentioned that have these plans? Is life for older adults, considerably better for those states? Or, is it a kind of a plan that just goes on the shelf, or are they really getting implemented, these plans? Thank you.
Oh, great.
I think we have an answer from the audience.
Can we get the microphone over here? We have somebody who is in front of the states.
I'm Frank Kessler, and I'm from Next 50 Initiative. We're a new funder in aging based in Denver, Colorado, and I'm here with colleagues from the Rose Community Foundation. And the plan does not sit on the shelf. It's very alive and very engaged. And one of the first things we did when we opened our doors is fund an aging czar in the governor's cabinet. So he has been very, very successful in getting the General Assembly to pay attention to aging issues, to focus on housing, transportation, et cetera. Plus, the plan wasn't just made and then shelved. There are groups that created the plan, and they continue to exist. And they've broken into workforce groups and housing groups and transportation groups and what have you. And they actually make recommendations to the General Assembly about pieces of legislation, and they also advise municipalities about how to organize things in municipalities for age-friendly communities. So I would say Colorado did more than just write something. They really have an action plan.
That's great.
If I could jump in, I think that it's incumbent on all of us. So we get a plan. It's our responsibility. It is older adults' responsibility. It's millennials' responsibility. It's all of our responsibility to make sure that it happens. We can't trust that whoever is elected the next governor in California is going to implement a master plan, and we're just going to sit back and hit the beach and let them do it. I mean, we have skin in the game, and we need to show up every day and hold them accountable.
But I think your question was very appropriate, because as I'm talking to journalists throughout the state, constantly pitching and talk about patience, I'm not a patient person either, and we wanted media coverage, from day one, and they've been a little hesitant because California has quite a few crises that it's dealing with right now. And I kept talking about a master plan, and they're like, well, when that master plan's done, let's talk about it. But they had the same concerns, and so talking about, again, we're holding the new governor's feet to the fire, I think is part of that. And then the fact that we'll have legislative hearings rolling out and we'll have actionable items, I think we'll keep that live and in front of people.
And I would add too, I mean, we know that a master plan for aging in California isn't going to be written overnight, and it's going to involve a lot of stakeholders. Frankly, the more stakeholders we involve, the more people are invested in it, and the more people are making sure it has a life and doesn't sit on a shelf. So your point is well taken. It's a kind of perfect model for how we see it going.
And I think the process itself, it doesn't mean that we have to wait for the plan to be done to have, legislators introduce legislation or regulators look at changes or the private sector look at changes that need to occur. I mean, that discussion will keep that debate going, at least we anticipate. Yes?
Hi, I'm just curious if I know your focus has been on the governor's race, but have you looked at other races? Or it sounds like there's been some trickle down of activity with the legislature, but I'm just curious if that's happened. But also, moving forward, are you going to focus on other elected officials?
Well, I can say at least at my level, at a sort of a local state level, as soon as it was released, as soon as we were able to start talking about it, I've been talking to every elected official in sight, every candidate running for every office. And as I mentioned earlier in my example with some of our clients, they have been empowered to go and use this kind of information and remind, even at the city council level. I mean, I use the example where we had this issue with a park where, our seniors were being harassed trying to use this park, and we were having a terrible time getting the city's attention, getting the police department wouldn't show up. And so we went to the city council member, and really they did. Our clients led the way, but we brought some of the statistics and showed them that people care about aging and reminded her that this is an issue that she ought to be concerned about because her constituents are concerned about it, not just older adults, but all of her constituents are concerned about it. And lo and behold, we're getting a curfew and good things are happening. So I think there's an opportunity to use this at every level of government. I also think there's an opportunity for each of you in your states to use this information, because I honestly don't think that California is special. If people in California care about it, I suspect they care about it in Michigan and Montana and Delaware. And so use these numbers and say that it's in their best interest to care about these issues.
Let me directly, yes, we have been wearing out our shoes, walking the halls in Sacramento. Could we do more? Absolutely. Have we been doing it? Yes. Has it been received well? Absolutely. Absolutely. So it's just a question of, going out, doing the work, but there's nothing that takes the place of going out and meeting face-to-face with those people. And again, fortunately, one of our partners with the SCAM Foundation, I mean, they have a true presence in Sacramento with very, very credible representation. So that's helpful too.
Yes, next question.
Thank you for the presentation. It's been great, and congratulations on such an effective campaign. I guess my questions are, I'm in the category of kind of engaging the older adults and making sure that their voice is ready and directly available. In this, I know it would be different in a campaign phase. I guess I'm looking ahead on your behalf to think about what happens when the governor is elected, when you need to implement this. Did you already have the capacity to mobilize individual older adults to champion this, to advocate, to show up in all the different districts around the state to make sure that it's happening? And if you didn't, what's the plan for making sure that's available going forward?
You're all going to look at me.
Yeah, well, so just real quickly, and then I think so, but we have some of those in terms of people who are members, if you will, people who have opted in to also take advantage of toolkits that we've created to make it really easy for everyone to be able to have their voice heard. But there's nothing like being confronted with somebody who was impacted directly. And when the lieutenant governor was at the Gary Mary West Senior Services, the Wellness Center, the Senior Services in San Diego, the governor, or the lieutenant governor had an opportunity to hear directly from many of those seniors, and he heard them, and his wife heard them, and his staff heard them. So more opportunities that we can create for people to be in that kind of an environment. Your instinct is spot on. I mean, that is very impactful.
And with the prep that we did and encouraging them to ask direct questions, I mean, people who were homeless, we're asking them questions about homelessness, housing, healthcare, I mean, all of those things. So he was getting legitimate questions and not just sort of broad brush questions. And so that requires a little bit of education because, a lot of older adults don't see themselves as advocates or being able to ask an elected official a hard question. But with a little bit of nudging and encouragement, and as Bill suggested, sharing some of their personal stories, it can be very impactful. I mean, I came away impressed. After spending an hour with the lieutenant governor, that he walked away and he remembered the things that he heard, because at the end, I mean, he was saying goodbye, but he was summarizing the things that he had heard. And this was just a few days before the election, and I honestly had low expectations. I mean, I figured he would come in, photo op, and be on his way, and he spent the time to actually learn. I suspect if we had had John Cox, he would have hopefully done the same.
Thank you. And I think part of the messaging and the campaign name, We Stand with Seniors Will You, was designed to be inclusive, but strong and not threatening, so that we can, pull from support groups for Alzheimer's families. And it's not such a complicated call to action, because people can bring to it, their own situations and identity. Next question.
I'm curious if any of you can predict the future and to think if maybe there is a movement that's state by state, and then eventually there'll be a tipping point, like there are with many movements like this, where it goes federal to help supplement some of the funding that we all know Social Security won't be able to cover in the long term, in the medium term, and even potentially looking at ways to help sustain Medicare, as the working population is going to be about the same as the older adult population.
Okay. That's first of all, great question. Yeah. I don't know if any of us are going to take the into the future view, but I think one thing that is related is certainly the overall cost of healthcare, right? I mean, it's just unsustainable. 18% of GDP, which is going towards healthcare, and with the with the aging of America in general, we have to figure out better, smarter ways. I think some of you are familiar with Civica RX, that the Gary Murray West Foundation is one of the founding members of. And if you're not, please, I encourage you to just Google Civica RX, and you will be amazed. Sometimes you just have to take some of those initiatives into your own hands in the private or the merging of the private and the nonprofit. I think we all have to slug it out every day to try to make that progress. We can't. The current state of affairs is not going to get us where we need to be, and in fact, it's going to. If you had a crystal ball, I think you would say it might be pretty dreadful. And I'm a pretty positive person, but if we don't fundamentally change the way we're doing things, that could be the glide path that we're on.
And I could jump in on that too. I mean, I think everyone in this room has an opportunity to help, because there's a whole aging network out there that is advocates that have been slugging this out for a long time. The game changer, and as someone who's been doing that for a long time, and I recognize some faces in the audience who've been doing it for a long time, game changer was when we had two major foundations step up and say, we're going to invest some serious dollars into making this happen. And that was the game changer. As advocates, we didn't have the money to do a poll and to do the outreach that we were able to do when this came together. So to do the kinds of things, because I totally agree with you, those that you hit on the major issues that we have to deal with over the next decade and come up with a plan. But it's really an opportunity for foundations to step up and say advocacy is an important component so that we can fundamentally change policy. So I would say it's a call to action to each of you to see what you can do to help spread the word.
Another question, Amy?
I'm very excited to hear this entire discussion. Thank you so much. It's really exciting. So no matter who gets into office, if they are advocates for aging and for the master plan, California wins, and in essence, we all win, because you're going to be leading the way for many other states. So the question is, what happens after they get into to office? How do foundations work with them to better avail themselves of the kinds of experts and the kinds of knowledge and understanding how to work with aging services, as you just mentioned? so that they can affect their master plan.
Want me to start that discussion?
Yes, please.
Yes, please. So we are currently putting together the plan for November and December and going into next year. Clearly, whichever team comes in, and as I mentioned earlier, I've worked for a couple of governors, so I understand those transitions. We know that right now, the lieutenant governor has 30 policy groups that are working on policies right now with about 350 people. So we're ferreting out, what they're working on and be working with them going forward. We've also encouraged all of our partners in the community to start sending both campaigns at this point, names of people that they think would be good, agency secretaries and department heads and commission members, because the more that we elevate those people in the state, that we want to be in there, we don't leave a vacuum for someone else to be put in a position that they shouldn't be in. So that transition will occur. It typically takes about 3 weeks for the new governor to actually sit down and engage and start putting together those plans. I would assume at this point, because of the point spread, that one candidate is already putting those together and one hasn't really started that yet. And then going into the holidays, they'll start implementing those procedures. Appointments, some of these appointments may not be made until end of next year. However, the campaign has been really wise, and with the SCAN Foundation's leadership, engaging state lawmakers at the Capitol. So we're not waiting just on a new administration. They're already engaging them to have hearings and to introduce legislation and to start talking about potentially long-term care insurance and what might that look like. There are groups looking at whether there should be a ballot measure or whether that should be legislation. I mean, there's a lot of discussion going on that I think this campaign is really energized. So I think that, to your point, we're still firming those up, and if you have any good ideas, I'm sure we'd love to have them. Does anybody else want to add anything?
That work is going on, Amy. Trust me, that work is going on.
Any other questions? Well, with that, I think we're about on time. So I'm going to wrap up a little bit and leave you with a couple of thoughts. First, I really want to thank the GIA and the sponsors and everybody in the room for attending this session and participating and bringing your value to the discussion, and for the panelists to take time to really talk about a project that, as I mentioned earlier, I get to work on lots of projects, but this one really resonates, and I know it's a field that you all work in day in and day out. So I'd like to leave everybody kind of with 3 key points to think about. When you embark on a campaign like this, or frankly anything that you're working on in your own organizations, what we found and learned is that there are 3 things, and you guys can jump in as much as you'd like. First, be opportunistic. You can lay out a campaign, but then look at what's going on in current events. Look what's going on in the news media. Shift your messaging. As I mentioned earlier, the generational poverty and some of the housing messaging came about because that's what reporters were writing about. So we wanted to insert our messaging into what they were already writing about. Secondly, partnerships really can make a difference, and they do make a difference. Bringing together the 2 foundations, the campaign itself wasn't seen as, the creation of one entity. So it had a much more of a common personality, and it was accepted much more readily, I think, by all the organizations. And then obviously combining resources, you can do so much more with one or more entities kind of moving that forward. And then lastly, be a catalyst for others to drive change. I think often in projects like this, we get focused on kind of one channel to drive change, or we drive change. But truly, this is a grassroots movement. And the more that we can catalyze and drive others, to affect change. For example, we have op-eds that are running. They don't really mention the campaign or the foundations, but we're working with leaders throughout the community to again make lots of different voices talking about the fact that now is the time, that we really need to make a change now. Any last closing comments you guys like to share before I wrap this up?
Just proud of the work that our collective team, the stakeholders, and certainly our partners with the SCAN Foundation, that again, we started this on March 12th. And this is where we are, and we would encourage you and appreciate any support you might have if you want to follow us on social media. Sign up on our website to get updates.
Thank you.
There you go.
I didn't want to neglect this. As Bill mentioned, for those of you online, go to our website and please join us. You'll be added to the lists, and we're also on social Facebook and Twitter. But on your tables is a postcard. We'd love to have you join us. The more the merrier, and the more powerful the messaging is when we have more experts involved.
I would also add too, on our website, there's a toolkit for how, like messages that you can share. And I know we haven't actually talked about it yet, but post November 6th, we'll need to update that toolkit with a new set of messaging. So those who have joined us know what, to communicate next and what to share with their colleagues and neighbors and everyone.
And I'd just say that we have a really big campaign bus, so there's room for everybody.
Thank you. And with that, I think our webcast will be ending, and I want to thank everybody, and hopefully there's some lessons learned that you can all share with your communities.